let's take a look at some of the common elbow injuries that we see in baseball players. I think we have a graphic where we can discuss one by one what they are. And the first one would be flexor, tell me if I say this incorrectly, tendinitis.
Flexor,
is that correct?
That's correct, flexor tendonitis.
And what is that, doctor?
So you have two, I guess, main bundles of muscles along your elbow. One's the extensor tendons, the other one's the main flexor tendons. The flexor tendons are on the inside or the medial aspect of the elbow.
All right, and then the next one, I'm not even going to attempt it, I'm just going to say UCL injury.
So a UCL injury, or ulnar collateral ligament injury, is what everybody thinks of in terms of Tommy John surgery and Tommy John injuries. But there are different variants of that you can get depending on your age.
Okay, and then I like the one that's in parentheses, VEO injury.
Yeah, so valgus extension overload syndrome is basically what happens is over time, if your ulnar collateral ligament stretches out, you start to wear on the other side of the elbow.
And then finally, stress fractures.
Yeah, so similar also to this is when you throw too much, you can get reaction inside the bone itself.
All right, we're going to go a little bit more in depth in terms of the UCL injury, and let's take a 3D model that we have once again, if we can, to show where this ligament is and what exactly happens when it's injured in baseball. So if we can take that, and doctor, why don't you walk over to our 3D image over there and tell us exactly what happens and what are the symptoms? What does one feel?
So, I mean, the most common complaint is pain on the inside part of the elbow. This can happen in a couple of different scenarios. It can be like a one-pitch kind of thing where the athlete feels something kind of either grab or give or pops a little dramatic, but they feel something on the inside. On the other hand, sometimes this is more gradual in nature and they kind of slowly get more and more pain. It's associated here, and again, this is if you look at our model here, the inside part of the elbow is over here, the outside is over here. So when we were talking about flexor injuries or flexor tendon injuries, the flexor tendons come off of this little bump right here and then course down your arm like this. Your ulnar collateral ligament or your Tommy John ligament lives inside of that, inside here. When we talk about valgus extension overload, that happens on the outside over here.